Hi guys, good morning. This is Dr. Rehman. So I'm going to talk about something very important today. We don't even think too much about it, but I'm going to talk about the thumb joint in the hand. You see, what separates us from the primates is of course, other things, but our thumb, because their hands are flat, so their thumb moves like this, but ours is rotated in 90 degree, so our moves in. So because of that, we have an opposing thumb, and we can do so many thousand things with our hands that the primates cannot do. So because of overuse of the thumb, whenever we're working, it becomes arthritic, and this is a joint called carpometacarpal joint. Many times people are having joint replacement for the carpometacarpal joint. So what do you do for that? So basically, the primary treatments are very basic. You know, arthritis is when you wear out the cartilage. Osteoarthritis is you wear out the cartilage, it burns out the edges of the bone with the friction, and they become irregular, rough, and they become painful, right? So you can use ibuprofen, Advil, you can use Voltaren, Voltaren, Voltaren gel on it 3-4 times a day. You can take a stretchy ACE wrap and wrap it up like a figure 8 bandage. No rocket science. You can see it on YouTube how to do it. It stabilizes the thumb and it helps a lot. You can have a harder thumb splint also, but ACE wrap usually works in most cases. And beyond that, people can do steroid injections. Gel injections are not approved for thumb injections, but you can do some really fancy things. You can do shockwave therapy, you can do class 4 laser therapy, you can do hot wax treatments, platelet-rich plasma series injections. You can combine that together or alone with the lipoaspirate or your fat-derived cellular mix from your own body, or your bone marrow concentrate stem cells, mesenchymal stem cells. You can also use the donated birth tissue, such as when you're having a C-section and you donate the placenta and the cord, right, before you go to the ER, operating room, I'm sorry. So at that point, they ask you to donate. So those amniotic fluid or the umbilical cord growth factor matrix, they are really amazing. So all these things combined, talk to your doctor which is the right option for you. And I'll talk about these options and all the other various options in future. Have a good day.